esteemed platform party, distinguished professor recipients, colleagues, and guests. Good morning. It's a pleasure to be here with you. So July 30th, 2020 was a dark, dark day for me. That's the day that Nordstrom's in Annapolis closed. It was a dark day. When I say Nordstrom's, what do you think of? Oh my goodness, their stores are gorgeous. They carry amazing inventory. They're just gorgeous. Do you think it's a coincidence that the escalator lands up in the ladies' shoe department? I don't think so. And don't even get me started on their jewelry department. Just amazing. Their staff are excruciatingly polite. They aren't even allowed to hand you your bag over the counter. They have to come around the counter to hand you your parcel. And their gift boxes, oh, don't even get me started on their gift boxes. They're the best. We would reuse Nordstrom's gift boxes at Christmas only for really good friends and family. Then when the store closed, the good friends were out of here. They were off the list. Now that they've been closed 2 years, the gift boxes can only be used for a family member that lives in the same house, so the box never leaves the house. Very important. And we've all heard the tales about how Nordstrom's will take anything back as a return, even a set of tires. You've all heard that urban legend, right? Okay, so Nordstrom's doesn't do tires, but you know what Nordstrom's does do? Service. You know who else does service? Palliative care. I believe that palliative care is everyone's right and responsibility, and we only get one shot to do it right. In my mind, palliative care is the ultimate in service to others. Palliative care is traditionally thought of as caring for patients and their families, providing that extra layer of support when they're living in the face of serious illness. Palliative care touches everyone. No one is getting out of here alive. I'm sure you have all heard the Harvard Law School legendary address given to incoming students. Look to your left, look to your right. At the end of the year, one of you won't be here. I can go you one better. So I want you to look to your left. Come on, look to your left. Look to your right. In 50 or 60 years, you're all going to be gone. So we'd better get this right because we only get one shot. Palliative care is our right and responsibility. We won't get a redo, so we have to get it right the first time. What are the patient's needs and wishes? Let's make sure we use good communication skills addressing those issues important to the patient. What are the needs of the family, and are we addressing those? Let's develop an individual plan of care that is holistic and addresses the biopsychosocial needs of everyone in the loop. But palliative care goes beyond caring for the dying. I remember years and years ago, I got a cold, and of course I did not take care of myself. Instead, I hopped on a plane to go to Cleveland to train with the Cleveland Clinic palliative care team. During the week, I got sicker and sicker and sicker. And when I got back home, I actually landed in the hospital with like quadruple pneumonia. It was bad. I was so congested and so sick. I remember begging the nurse, please make sure I'm still breathing during the night. Please don't let me die. She solemnly swore she would do just that. Now, of course, even though I felt like I was dying, I really wasn't, but it was tremendously reassuring. Such a sense of relief knowing that that nurse had my back. The nurse gave me palliative care in that instance. We must always consider, what does it mean to take care of someone? How can we do what's needed in the moment? If this was your mom, your sister, your child, how would you want them treated? We owe a debt of palliative care service to everyone and anyone we meet. The second thing I'd like to talk about is focusing a bit more on who are our customers in palliative care. Who are we providing service to? The obvious customer, as I just said, is palliative care, is patients and their families affected by serious illness. What service do we provide this vulnerable population? I just shared that palliative care is a holistic, biopsychosocial model of care. As a pharmacist, my particular expertise is pharmacopalliation, picking the best drug to treat a physical symptom with the lowest burden possible. But I'm pretty convinced that we must be prepared to practice in a transdisciplinary fashion. I always say that I am not happy until everybody around me goes home 10% pharmacist. And you can be sure I am 10% social worker, 10% nurse, 10% chaplain, and so forth. If I'm visiting a patient to discuss their drug therapy, but the patient interrupts me to say, hey, the doctor was just here and he said, I've only got about a month left. Do you believe that? I can't just throw something casually out like, sorry, sir, that's not my jam. You have to be prepared for any contingency. Palliative care providers work in a transdisciplinary fashion to cover the waterfront. We have a saying in drug information that the medication question someone asks you isn't necessarily the question they want answered. I've learned by channeling my inner social worker that sometimes the most powerful thing I can say to a patient or family member is, tell me more. Very important. Good communication is not just a buzz phrase, it's the real deal. People just want to be heard and understood. I remember when I was in pharmacy school, just down the road a little bit here, and Dr. Robert Beardsley was teaching a class on communication skills. One day he said, you'll be in your pharmacy and a patient will come in and be very angry about something. They may even be yelling in your face. You should say to them, you seem to be upset. I remember thinking, is this guy for real? Somebody is going to be yelling in my face and I'm supposed to say, you seem to be upset? I thought Dr. Beardsley was out of touch with reality on that one. Let's fast forward 5 years, and I'm in clinic at University Care Waxter, as it was known at that time. I was seeing a patient for the first time who was indeed very upset about his poorly controlled chronic pain. Again, this is the first time I'm meeting him, and here he is yelling in my face. I remember thinking, what is wrong with this guy? I have no idea why he's so upset, and he's sitting between me and the door. What am I going to do? I thought of Dr. Beardsley, and when the patient paused to suck in a breath, I jumped in and very softly said, you seem to be upset. My takeaway observation was it's really hard to yell at someone if they've just agreed with you. This is an upsetting situation. And of course, I followed with my other line, tell me more. I gave that man palliative care. But the recipients of palliative care are not just patients and their families. How about our students, our colleagues? Students see how passionately I feel about palliative care, and that gets them excited. I'll bet 90% of the applicants to all of our schools, when you ask that important question, why do you want to be a physician, a nurse, a social worker, a pharmacist, or whatever it may be? They say, because I want to help people. That's palliative care. But we have to practice what we preach. I mentioned earlier that it doesn't have to be a dying patient for you to use your palliative care skills. How about our students and colleagues? How can we be in the moment with them? A student in our new PhD in palliative care program asked for a little grace during a course last semester as her grandmother, who raised her, lay dying. She later wrote in her reflective journal post, what a team at UMB. I always knew the palliative care team model was for me, but the fact that this kind of compassion even spills into palliative care education just confirms I'm in the right place. We can show others in our lives a little grace and compassion by passionately adhering to the service of palliative care. The last point about the service of palliative care that I'd like to share is the importance of recognizing the tipping point moment. This could be when we've gotten to the point where the benefits and burdens of an intervention are about equal, or perhaps the burden is even winning in this circumstance. But if you ever say to a patient, there's nothing more I can offer you or do for you, like my friend Liam Neeson says, I will look for you, I will find you, and I will not be happy with you. Absolutely. Palliative care helps us weigh the benefits and burdens of treatments such that we can balance the quality and quantity of life. Let me be clear, palliative care is not the withdrawal of care. It's providing care that is consistent with the patient and family's goals of care. We call this goal concordant care. For every therapeutics module we teach at the School of Pharmacy, we have a learning activity toward the end of that module that addresses how and when to de-escalate therapy. It's really important. In my practice, this is often a conversation about continuing versus stopping medications. Research has shown us, and this will blow your mind, on the day a patient dies, 1/3 of those patients will have received a dose of a preventative drug. What's with that? Deprescribing is a normal part of the prescribing continuum, but you can bet you had better have some seriously good communication skills when these conversations occur at the end of life. Try talking an adult into stopping grandma's statin after the heart doctor said, you'll be taking this for the rest of your life. This just in, you can go to heaven with an LDL over 100. It's all good. When breaking serious news to a patient and family, sometimes the best thing we can do is to be a compassionate presence. Sometimes you just have to sit with the sadness, and you only get the one shot. But in all of our roles and relationships, we may need to give or react to serious or bad news. Maybe it's a student whose mother just got bad news, or maybe a colleague who just got some career-related bad news. Even though you can't fix it, you can be that compassionate presence. That's the service of palliative care, and you only usually get one shot. I recall a few years ago, one of our pharmacy students, one of my advisees, asked to meet with me. It was residency recruiting season, and she had applied for several residency positions. She was crying uncontrollably. She was a hot mess. She was absolutely, positively convinced she would not match for a residency position. Well, as a professional catastrophizer myself, I recognized the situation for what it was and knew immediately that we had to run the baby chicken little was right game. So I said to her, first, I explained, I think you've got a very good chance of matching for a residency, but let's imagine what will become of you if you do not match. What will you do? In between sobs, she said, well, I guess I'll have to take a job working as a pharmacist. Okay, and what will your starting salary be? Oh, I think it's about $125,000, $130,000. Okay, so let me get this straight. On the slim chance you do not match with the residency, the absolute positive worst thing that can happen to you is you'll have to accept a job as a pharmacist earning $125,000 to $130,000 a year, gain a year of experience, and reapply next year. Am I correct? Crisis averted. That was a palliative care moment. I gave her what she needed in that moment. Some of you may be old enough to remember William Donald Schaefer. He was mayor of Baltimore and then governor of Maryland. To be sure, he was a scamp, wasn't he? But he would ask everyone he met, have you helped someone today? Palliative care is a service to others best served with equal measures of passion and compassion. You don't have to be trained in palliative care to do this work. But if you want to apply for our Master of Science or PhD in palliative care, I am happy to take your application. You can do this. Keep your eyes open for those opportunities. When President Gerald called me and said, I'd like you to talk about palliative care, but I want you to make it sexy. I hope I've convinced you that palliative care is an unalienable right and responsibility. It touches every single one of us, and often you only get that one shot. I hope you thought my presentation was sexy. And if you could sign the petition to bring back Nordstrom's and Annapolis as you exit, I'd be very grateful. Thank you.
I get blamed for everything. But I will say, important topic, and it'll be important to each one of us. And so hence it's on the schedule. But one thing's for sure, I'm not going to be looking to my left or my right anymore.